with the client in the sideline position, we can have fabulous access to the neck shoulder complex and include some work over the upper thoracic spine as well. So let's take a look here to see if we're addressing releasing the tension around the tight shoulder and neck. Sideline gives us fabulous access. You can work on some of the superficial mobility, such as the skin gliding. See which direction that they're tight. You can even start to work into some muscle play. With muscle play, we're working on muscles in groups to move them, stretching them transversely across their axis. So if you're thinking about the middle deltoid, having a more vertical axis, grasping that muscle, lifting like you're peeling it away from the bone, and then stretching it posteriorly or anteriorly using your palm, especially with people with adhesive capsulitis or frozen shoulder, that posterior glide stretch is very nice for the muscle play. And you can get in very nicely to some of those tendons that get so tight at the proximal aspect of the glenohumeral joint. So taking up the slack and holding until you feel a softening effect. So here we're getting some of that anterior deltoid pec complex, a little bit of the lats also, because you have the pecs and the lats and subscapularis all attaching here proximally at the anterior aspect of the shoulder. So it's a nice way to open up. I could start to add some mobility to it too. I could add some extension, letting that arm drop back, stretching now into some of the pec minor. So depending upon the angle that you position the patient, I'm also grasping the scapula to stabilize the scapula here. So I have my fingers under that medial border of the scapula, dropping that shoulder back, and then holding that position to get that nice stretch to the tight anterior muscles that are pulling into a forward head, pulling into that protracted shoulder position. So that's a nice thing to do in side lying. You can also work on releasing some of this levator upper trap complex, getting some scapular depression. Her neck is in a nice neutral position on a pillow. And if I'm thinking just stretching origin to insertion of the muscles from the acromion to the occiput, depressing the scapula, and then holding and waiting for a little release. Again, some of these releases may take a minute to two to release, but it's definitely worth the wait. I find the carryover is much greater with the waiting for the body to release. You could even add to it some hold relax techniques. So just lift up this shoulder a little bit into my hand and relax. So just a couple seconds of a gentle hold followed by a little bit more depression. You get that nice latency time after an isometric contraction that it's easier to stretch. The body's more amenable to it. Lift up again, just a touch, and hold it 2, 3, and relax, and breathe. Always work with the breathing with your clients so that they are opening up and relaxing, also stretching from the inside out as they breathe. Get some scapular depression. You can also come from